Allow everyone to join. Good evening, everybody, and thank you for joining us tonight. We know that you as students have a lot of things going on with tests and your classes, and even some of you guys out on field work right now. So we are grateful that you are here this evening. I want to remind everyone to please utilize the chat feature if you have any questions or comments throughout the presentation, and please stay on mute if you do not mind. Our presenter has given us permission to record this presentation tonight. So if you miss any of it, you can go back and look on the TNOTA website under the student section for this virtual chat recording. So we surveyed the members of the Student Involvement Committee with the Tennessee Occupational Therapy Association a few months ago, and the top topic that you all as students wanted to learn about was board exam preparation. And last fall, I was able to listen to a few of the presentations by Dr. Rita Fleming Castaldi, who is with us tonight. And she was presenting through the AOTA on OT and OTA board exam preparation. And I thought she will be wonderful to have to come and speak. And she graciously accepted and is allowing us to record and interact and answer questions. So I would like to read a little bit to you about our presenter, and I'm going to hand it over to her. So I'm pleased to introduce Dr. Rita P. Fleming Castaldi, who will be presenting on board exam preparation for OT and OTA students. And she has specifically geared this presentation to questions that you all have asked through emails, through messages, through other questions and meetings. Dr. Fleming Castaldi is an occupational therapist and a professor emeritus at the University of Scranton and chairperson for the History Preservation Project of the Occupational Therapy Leaders and Legacy Society. She is the author of the National Occupational Therapy Certification Exam Review and Study Guide and the National OTA Certification Exam Review and Study Guide, in addition to editing and authoring several other books, journals, and texts. So please, everyone, welcome Dr. Rita Fleming Castaldi.
Thank you, Jennifer, and I greatly appreciate all of you who are taking time out this evening to join me. Tonight I will be presenting on test-taking strategies and resources to ensure academic success and attain future certification exam goals. The focus of the title that I selected for this and the focus of the presentation is based upon, as Jennifer said, the questions that you raised to her, to share with her, to share with me. And also I had asked Jennifer to ask when are people taking the exam. And it was a mixed group, with some people taking it this year in 2024 and some taking it in 2025 and 2026. So I wanted to make sure I addressed both cohorts, those who are taking it this year and those who are taking it later. Before I begin, I do have to say that Therapy Ed is not affiliated with the National Board for Certification in Occupational Therapy, which is the NBCOT, and the NBCOT, OTR, and CODA are registered trademarks owned by the NBCOT. I also needed to clarify, and Jennifer, I apologize for not doing that when you had sent the email that you had heard my AOTA presentations. Actually, Therapy Ed is also not affiliated with AOTA. I am a member of AOTA and very active in many projects with AOTA throughout the course of my life, and my FAOTA. I'm a fellow of the AOTA, and the Leaders and Legacy side does work very closely with AOTA. And I do post and share information about the webinars that I'm giving informationally about, like most recently, frequently asked questions about the 2024 exam. And the links to those and information about those are posted on AOTA's community page. So that's how a lot of people sometimes affiliate me with AOTA, but it is presented as part of Therapy Ed. But because I focus on content that is just not about the products, but is actually factual information about the exam, AOTA does support my posting it. And Neil Harvardson, who is the chair of the Academic Leadership Council, who not the chair, but he's the AOTA staff person who connects with the ALC. He will often share information about the webinars that I am doing. So it is an honor to be here tonight. And I'm going to. So these were the questions that were posed. How do I reduce anxiety, not get overwhelmed by the material? If those of you who were here before we started recording and started formally, I mentioned that I got into exam preparation because when I became a program director in 1993, so 31 years ago, students came up to me on the first day that I was program director and said, "We need to talk." And I was like, "Oh my goodness, what's up?" And they just was so stressed about the exam. They were coders in and we were a bridge program, but code is going to be OTR. And they had working full-time as coders, had children, had caregivers, multiple responsibilities. It was very overwhelming. So the faculty and I said, okay, we'll try to make this better. To make it so it's less overwhelming. So in 93, we developed a content review course where we kind of help them review all the content they've learned through the curriculum, which gets into being overwhelmed by studying. And to make it organized, you've got to bind it together. And in 1998, Therapy had contacted me and they had heard through the grapevine. We were in New York, but they were in Chicago, but we had gotten a good reputation in the Northeast for doing a good course. So they had heard about it when they asked some people in that they knew in the Northeast, and the rest is history. They contacted me in 98. I started working on the Therapy Ed Review and Study Guide in 98, and the first edition was published in 2000. And now we're in the 10th edition for the OTR text and in the 5th edition for the coded text. That came out in 2005, the first one. So the key goal for all the work I've done for Therapy and formerly as a program director was making this less overwhelming. Okay. Facts versus fear. And that's what I'm going to be focused on, giving you a lot of facts so there's no need to have this anxiety. Because unfortunately, there are a lot of things that are on the internet or you may get any emails that really increases anxiety quite a bit. And I don't think there's any need for that. So that's one of my main goals, that you go out of here feeling that you're in control of this situation and that you can do it, that you got this. Okay. Then I will talk about what you're going to expect. What can you expect on the MBCOT exam, about the content and the format. So I'll give you factual data right from the MBCOT website and from their documents. Then the question about when should I start studying, how much time is needed, I'll cover. How do I best prepare? Any study tips that are helpful? And which exam preparation products should you use and which are most beneficial? Now, of course, full disclosure, I do Therapy as product development. I am the director of education, but I'm going to give you criteria for which you evaluate all products, because there are many products out there. And some are good and ethical. The AOTAs and MBCOTs are very solid preparation products, and they meet the criteria that I'm going to be giving you to assess whether you should be using the product or not. And then some others are not. There is a profit margin in exam preparation, and some are maybe not as ethical at priors as others. So I want to make sure that when you do get preparation products, that you are getting things that are accurate and current and will adequately prepare you for the exam. Okay, so because people are going to be taking the exam, as I said, over 2+ years, the goals of the webinar are going to be to diffuse test anxiety, replace fear with facts, provide accurate information about the content of the OTR and code exams that are in effect now, and they will be in effect for 4+ years. The MBCOT updates their exam every 5 years based upon practice analyses. So the exam that just ended in 2003 was implemented in 2019. The one that we have that's been implemented in 2024, it will shift over in 2029. Okay. I'll also give you some general exam preparation strategies and provide some resources so that you can do more investigation on your own, because we do only have an hour and I want to make sure I save time for questions and not rush through this. And some strategies and resources for mastering what you must know. There's a lot of content in OT land. My son calls my world OT land. So how do you prioritize and what is the must know? So I'll give you some resources for that. And I'm going to describe some current, accurate, and effective exam preparation products and resources that can enable success. Now, if you are a member of AOTA, I did an OT practice article, and it is archived on the OT practice website. And this is a 2020 article, so it's not that old. And in this article, I talk about using clinical reasoning to help you answer, figure out the best answer, and some other hints about the exam. So just write down OT practice in 2020 and you can scroll my name. And I just wanted to let you know that that's a good supplement for some of the information I'll be talking about. Okay. The MBCOT, the reality is it tests the depth and breadth of OT practice, of OT and OTA practice, depending on your exam. So there's a lot, there's a lot you need to know. The other reality, though, there's so much content that needs to be mastered, but there's also an abundance of resources. Class notes, your texts, now we have videos, we have podcasts, PDFs, thousands of questions you can access through multiple mediums. It can be overwhelming. And there's a press in social media these days. And one student once said to me, it's like going down a rabbit hole. And so this is the rabbit hole of all the resources you have. And there's a lot of press to use all the most available resources. And that can increase stress, just even from an economic point of view, because it can get very expensive. There are on the AOTA Facebook page, which is a great resource for many people about exam prep. But sometimes people will post their study plans and they'll list every single product that they put. And there'll be 6 products and how they study from each of those about one content. And I'm here to let you know, you really don't have to review 5 products, even 2 products, to know wheelchair measurements, to know reflex. You really only need one source because they're standard procedures that we do. So there is a press there, and the social media, a lot of students said, has greatly increased their anxiety about the exam. The other issue is that sometimes it's inaccurate information about the exam. Over the years, I'm not going to share. I will give a resource for Therapy Edge YouTube page where you can listen to other videos that I've done and recorded for AOTA Inspire, for other state associations. But there's some very bizarre statements that are sometimes made about the exam. And it's very difficult to discern what is true and what is not true when you are, a student, and misinformation can hinder your success. So I'm a firm believer in having facts. Okay. So that was the other. Okay. So we're going to decrease our anxiety and not get overwhelmed by the material by recognizing a couple of key facts. The fact is, yes, the amount of content knowledge that's tested on the MBCOT exam is a lot, as it should be. You are in school, and wherever you are in the course of your education, you are learning a lot, or you have learned a lot in field work. The exam is the licensure exam for every state in the country: Puerto Rico, Washington, D.C., and Guam. Licensure boards want to make sure that you're qualified. MBCOT, if you're going to be registered and certified, wants to make sure you're qualified. So you do need to test the depth and breadth. Okay. However, the other fact is, when you're eligible to take the MBCOT exam, whether it's this year or 2025 or 2026, you've earned the status of being an exam candidate. You are no longer a student. You've had to graduate from an accredited OT or OTA program. The fact is, OT and OTA education is challenging, and you had to pass challenging coursework and field works and possibly a capstone. So you clearly know a lot once you get that you take the exam. You've got this. You have the knowledge and the skills that you can apply to your MBCOT exam. The other myth I'd like to dispel and share a fact is, no one who is eligible to take the exam is a bad test taker. A lot of students say, I'm terrible to test. There's no one who becomes eligible for the MBCOT exam who can be a terrible test taker, because you had to pass a lot of tests. Okay, just think of all the tests you took in your prerequisites before you even got into OT school. And then once you're in OT school, most schools, to stay in the program, you have to get at least a B-. You don't need to get a B- on the MBCOT exam, okay? You don't need to get an 80. So you can't be a bad test taker if you're eligible for the exam, because you never would become eligible for the exam. You would have failed out of your program, okay? Now, is test taking in our comfort zone as OTs or OTAs? No. We like to think holistically. We like to think of every nuance. We like to think, well, what about this? And what about this? And what about this? And that's what makes you a great practitioner. And then, we give you 2 sentences and say, pick the best answer. It's counterintuitive to how we are as an occupational therapist or an occupational therapy assistant. But the reality is you can do it because you've done it before. Okay. Will you want guidance to do this effectively? To apply your knowledge and your skills from fieldwork and capstones effectively, efficiently, of course. But fortunately, there's a lot of solid resources that have been used for over 25 years to help aspiring OTs and OTAs pass. So these resources are proven, and you can use them to pass. And when you start getting anxious, remember that you earn the right to take this exam. All right, so I'm going to go briefly through content. Okay, what is the format? First, I'm going to do the format because there is concern sometimes. There's one product out there that's, kind of sharing a lot of fear about, oh, the exam is so new, the exam is new this year. It's going to be, pass rate's going to go down. Not true. To be honest, the code exam has not changed significantly, and I'll show it in a minute. It has not changed its format at all. And the OTR exam, the change in the format has actually resulted in a more user-friendly exam. Okay. And I'll share when you go onto the YouTube channel, you can just Google Therapy Ed, facts about the 2024 OTR exam. And I have a whole session about that. And I can even send Jennifer the links that she send out to everybody. So the big change is instead of 170 multiple choices, there's 180. However, there's no more clinical simulation test items, which was stressful to people because they were at the beginning. You could only say yes or no. You couldn't change your answer. Now the exam is all multiple choices, and they're the traditional 3 or 4 option. We just pick, 1 out of 3 or 1 out of 4, and 6 option, what's called multi-select scenario sets. And I'll have a picture of that. They're mixed in. There's no separate section anymore. So your timing, you just keep moving along. You don't have to worry about a separate section. They are distributed. There's no predetermined percentage, but they're all, the exam is designed to be done in 4 hours, just like the old exam. So they're not going to give you too many because they want people to complete the exam. Okay. And basically for the 3 or 4 option, pick the 1 correct. The 6 option, pick 3 correct. And I'll have a sample in a minute. No answers or combinations. So it's nice and clean. For the code exam, the big changes went from 200 items to 190, 10 less. Okay. And the code exam since, gosh, I know since 2019, but I think it may have even been before that, may have been 2009 or 2015. They have the 3 or 4 option like the OTR, and they have a 6 option multi-select multiple choice item. So it's the same kind of thing as now in the OTR. The OTR is similar to what was in the CODA, where you select 3 out of 6 for the correct answers. But instead of having a set, just sets are 4 items that like relate, and I'll have a screenshot to show you in a minute. You just have one item that is do 3 out of 6. Same as the OTR, there's no predetermined percentage, and the same thing, you pick the 1 correct answer for the traditional multiple choices or 3 for the 6 option, and there's no combo answers. And this exam these are screenshots that are taken from the review and study guides. We try to make things that should stand out to make sure they do stand out. So they're boxed so that you can see them, things that are important. So here's an example. So if people want to put into the chat box what you think the correct answer is, and I will only call on a person that has the correct answer. Okay. So we have here, because sometimes people are, well, what do the NBCOT exam items look like? And sometimes with objective exams, we're used to just basically knowledge based, but not, applying it to a practice setting. So here we have an occupational therapist and OTA provide services to enhance independence and safety of residents of a skilled nursing facility. So to do that, they periodically screen residents' fall risk. So what is the purpose of this fall risk screening? So what do you think? Is it A, determine environmental modifications to decrease fall risk? B, develop balanced mobility intervention programs for residents? Adapt their performance, provide adaptations for performance of ADL? Or establish need for evaluation? Does anybody want to venture in the chat box? Okay, we have C, we have D. Okay, yes. Kate, you and a few of your peers are correct. Why did you select D? Because you were absolutely correct. Can you unmute yourself and explain your reasoning? Because you are correct.
Yes. So a screening usually is to see if further evaluation is needed. So if there was a increased fall risk due to a lower bounce score or something like that on the screening, then you'd want to do further evaluation.
Exactly. You picked up on the key word, a thing that we teach that is in my textbook, and we teach in the therapy of course, is always look at the stage of the OT process. Your correct answer must be consistent with the stage of the OT process. If it said they evaluated them and then what is the intervention, these other things may come into play for intervention planning. But exactly, screening, the outcome is always evaluation. Perfect. Pat yourself on the back. Excellent. All right, now I'm going to do a multiple choice item, a 6 option, multi-select. So this is straight from one of the therapy course. This is an item from that for the OTA. So you have someone who had an MI and is nearing discharge from inpatient cardiac rehabilitation unit. So again, the setting is important. Anticipation of discharge, intervention goals have been established with the client to help the ability to engage in home management and leisure activities. Which activities are best to provide? So there's a diversity of activities, and due to time, I'm not going to have you put them in the chat box because this takes a bit of discussion in the course. But I wanted for you to see what these look like if you've never seen one before. Now I'm going to show the same item, but it's been reformatted to be a scenario set item. And what makes the OT exam item different than the CODA is you have 4 scenario items and they have the same information that's provided. So give this background. And then they'll say item 1 of 4 or item 2 of 4, 3 of 4, 4 of 4. And each one will have this information, but then we have something specific to ask about the person, okay, about that setting. So to know this, I'm going to move into where the correct answers are and what you would have to know, what you would need to know. Save time to pick the 3. You would first want to eliminate things that sound too low, okay, because the client is getting ready for discharge. So anything that is seated, B should be out because that's too low of a MET. And sewing and knitting should be out because that's also too low of a MET. So process of elimination. So don't get over nervous about these picking 3 out of 6. Use the same strategy that you used for irregular multiple choices from 3rd grade. Remember, always eliminate, right? So you would need to know that prior to discharge, someone has to get ready to be at a higher level, okay? Anticipation of discharge. So they should not be doing seated activities. They should not be doing seated activities because that's at 1 to 2 MET. When someone's getting ready for discharge, they need to be doing like 3.5 MET, 3 to 4. But then they also are not going to be at the level of outpatient cardiac. So D would be too high. So again, using process elimination, getting rid of the ones that are too low, getting rid of them too high, you get the correct answers, okay? So that's what the format of the exam looks like. Now, what is on the exam? What is the content? Okay, every 5 years, as I mentioned, they do surveys of practicing OTRs and CODAs to determine the core tasks that comprise entry-level practice. That's a key word, and the knowledge required to perform those tasks. The outcomes are what's used to construct the outline, the specification, and that's what the item writers use to guide their writings. Now, important thing to know is NBCOT considers entry level. Those have been certified 36 months or less, excuse me. She may actually have questions on the exam of you supervising someone else. A CODA with a year experience supervising a new CODA. An OTR with, on day 1, CODAs will be supervising aides, and on day 1, OTRs will be supervising CODAs possibly. But after a year of experience, you'll be supervising other practitioners. So you may even get questions to that about you being a supervisor. The important thing, though, it is generalist knowledge. It's not specialized. And it's what's required for entry-level practice. So it's not going to cover any advanced specialized knowledge. There's a product actor that includes information about the NICU. So periodically I'll get emails and saying, you don't have anything about the NICU. And I'll say it's not on the exam, that's specialized. So anything that requires advanced certification is not on the exam. And you could go right to NBCOT's website and click on, and you can get the practice analysis and you can look at how they do that and gain information about that if you're interested. What is most interesting, though, to you guys will be the content outline. And those are on the website. So this is the OTR content outline. And I'll have a screenshot of the CODA. And basically 23% of the exam is about evaluation. 23% is about intervention planning. 38% is about implementing intervention. And 16% is about those indirect services. How do we manage ourselves? So quality assurance, research, program planning, okay, accreditation, reimbursement. 84% of the exam, though, of the OTR exam is about working with clients. So all the things you're learning on fieldwork, all the things you learned in your practice courses are directly applicable to the exam. Now, this is a screenshot that I took for the CODA, from the CODA book. And the similar one is I just did not have my screenshot function somehow was not working right the last couple of days. So I didn't have the ability to do a screenshot of this one, but that's also in the book in this format. And basically the CODA exam covers a lot the same. The content outline someone, a lot of times are very, very, very similar, if not the same. The one different domain one is about contributing to the evaluation process. Domain one is very similar in focus. It's about acquiring information, sets evaluation. Domain two goes into more the implementation of intervention. So, and then domain three is also the indirect services. Okay, how does the CODA contribute to quality assurance? How does the CODA contribute to needs assessment and program planning? So, and again, you could go right on therapy on NBCOT's website and you could look at the whole content outline. I've done that in our book, and I've made sure that all of our content, all the statements of what is must know information on the NBCOT exam is included in the book, and I'll have a few screenshots coming up. The thing to know that in both the CODA and OTR exam content outlines, the NBCOT provides statements that identify the specific tasks and knowledge that's required for safe and competent practice. So they're very specific about what you need to know. So when people say, oh, we don't know what's on the exam, we do know what's on the exam. Okay, so here's an example statement. And this statement, I picked ones out that are the same in both the OT and OTA. Okay, both the OT and OTA has this statement about one of the knowledge you need to know is interpretation of qualitative findings, including the occupational profile, also needs assessment and interviews. Now, this is a box that's in both books, and it basically gives you the questions. What are the things that you need to be asking an occupational profile? This box, it was too long to fit into the screen so you could see it. It also has questions about the person's occupational history. What are their personal environmental factors that may hinder engagement? So you can have a question on either the OTA or the OT exam that, asks you what question, a therapist or an OTA is meeting with a client to compose their occupational profile. What questions should they be asking? So answers that are consistent with the information in box 3.2 would be correct answers. Okay, another represented knowledge statement. This one always makes people anxious is reimbursement. They do say you need to share reimbursement policies. Now, the fact about the exam is the exam will not ask private insurance. They will ask Medicare because that's our national insurance. That is one that is not specific to plan or not specific to state. So in both books, I have charted out so it's easy to read. I have a thing on Medicare Part A, Medicare Part B, durable medical equipment, homebound status. So you do need to know those because correct answers will be consistent with Medicare guidelines if they say a person is a Medicare recipient. So knowing that with DME, if someone's on Medicare, they're not going to be able to get raised toilet seat or grab bars because other people can use them and they are comfort and convenient and they're not considered medically necessary. What they will cover under DME is a 3-in-1 commode because generally it's not useful to a person who doesn't have a disability, okay, or illness. All right, so that's the thing you need to know. So your management classes also come into play. Now those things have been in the exam for a long time. Occupational profile and Medicare has been for a very long time. A new thing for the 2024, a new knowledge statement is about preventing professional burnout. Okay, so we did add that to the textbook, to the 10th edition, to make sure we do cover professional burnout. And this is an example of strategies to prevent professional burnout based upon extensive literature review and resources that would be able from AOTA and other. And I've always actually included prevention of burnout and burnout in all my leadership classes since probably I started teaching, because I always knew it was a very important thing to include. So I've always included in my management classes, but this is the first time it's been on the NBCOT exam. Now this box is from the CODA, the OTA review and study guide, but the same information is in the OTA review and study guide. So you may get a question asking you that you as a supervisor, because remember you see that people are, presenting with burnout. What do you do as a supervisor? Or it could be that you as a therapist or an OTA is experiencing burnout. What should you do? And the correct answers would be consistent with these standards here. Okay, just want to highlight that, those are just a couple examples of knowledge statements. The chapter 3 in both textbooks go through all your clinical professional reasoning, activity analysis, education training, group dynamics. Do expect that we do a lot of interventions in group, in schools, in mental health, in long-term care, community-based settings. So that's covered in great depth. And this is where it covers the complete OT process. So all the different standards for that. Chapter 4 is competency and practice management. In the OTA review and study guide, it's called professional standards and responsibilities to be consistent with domain 3 of the NBCOT content outline. But this is where you get all the things that you need for that 16% and 17% of the exam. How it does ethics play out in practice, supervision, all the teams, U.S. healthcare system, payment, documentation, legislation. Correct answers on the exam must be consistent with IDA, ADA, HIPAA, OPRA for restraint reduction. Okay. All your service management tasks, needs assessment, program planning, and then research and how, and for the OTA, it's how does the OTA contribute to evidence-based practice? And then professional standards and competency, professional development, and then burnout is in both of those chapters. Okay, another knowledge statement is your PED stuff. Okay, you need to know your PED stuff. A task that's on the exam is recognize the influence of development and lived experience and body structures, values, beliefs, spirituality, and identity on occupational performance. And a big knowledge statement, number 1, and that is typical development and aging. Chapter 5 in both review and study guides covers all your developmental milestones. Everything from sensory motor development, grasp, scissor skills, reflexes, pre-writing, writing, adolescence, our Erickson, our Piaget, and then aging and all the systemic body system changes that occur with aging and what are the compensation and adaptations for that. I did want to make sure I put this up here because there's one person who, there's a person who does a podcast called OT Prepper, and he does it for free. So, and what he does is he shares the mnemonics and the things that he developed for himself to help prepare for the exam. And he's a good guy, and he's just really trying to be helpful. And if you know Harry Potter and Star Wars, you'll probably do very well with his podcast because he was a very big fan of Harry Potter and of Star Wars. So all of his the mnemonics that he used relates to like the houses in Harry Potter or the people in Star Wars. If you don't know Star Wars or Harry Potter, you'll probably be lost. Okay, so I just want to let you know that. But I did want to bring this up and put this front and center because in one of his podcasts, he has a podcast about development. And he does make a false statement. He says that knowing the CDC guidelines is sufficient for the exam. I don't think that is true because this is right from AOTA. They talked about the benefits of the CDC guidelines, that they provide parents how to look at milestones. It decreases use of waiting and seeing, okay? Places milestones into context. But the limitations, and these are big limitations that the AOTA, when the CDC guidelines came out in 2020, these are big limitations that the NBCOT exam will not ignore, okay? They cannot be used as screening or diagnostic tools. So they don't take away the need for OTs and OTAs to know how to evaluate development. They don't remove that. So you still have to know your developmental milestones, okay? They just don't include, and they don't include all the milestones that they may achieve. So, and I've looked at them. They have some that are there, but there are definitely gaps. And not that you have to know every milestone to pass the exam, you don't. But the thing about not having any knowledge, say about hands, fine motor skills, pre-writing, grasp of a pellet, grasp of a cube, scissor skills, drawing. If you get any question about that on any of those items on your exam, you're always going to be like, oh, I don't know that, I didn't study that. I don't know that, I didn't study that. And that's going to increase anxiety. And your job on the exam is to say very cool and to have a good handle on most topics. And if you only study the CDC guidelines, you will have significant gaps in your developmental knowledge, okay? So you don't want to just study those. And other than that, he's fine. That's the one mistake that he's made. But again, you need to know Harry Potter and Star Wars. Okay, the other statement, and this is an example of an exam hint. So to help you target in what is must know, this is a direct quote from the OTR content outline, and the CODA exam content outline has the same requirement that you need to know patterns, progressions, and prognoses associated with conditions that limit occupational performance, including the signs and symptoms of diseases, the stage of disease, and any complications. That's a lot, okay? So rather than having to go to all your pathology books or your clinical conditions books, basically the authors, and all these authors are people who work in these areas. So Colleen works musculoskeletal, Regine does cardiopulmonary, Dan Geller and Glenn Gillen did neuro, and Cynthia, oh, I apologize, this has an error, that's an old screenshot. And these are people for all the other body systems. So they cover all the disorders in the different body systems in one spot for you. So you will see what are the symptoms, the signs, prognosis, complications. Okay. The other thing is, again, a represented knowledge statement is orthoses. Needing to know the orthoses and what are the implications of selection and design. So we have pictures of some biomechanical orthoses and then ones that are used for neurophysiological disorders. So the Sable Stretch Dynamic. Okay, so we have those throughout. Physical age and modalities often raises a lot of concerns, and this is again a criteria for both the OT and the OTA. But knowing your contraindications of superficial thermal, knowing the contraindications. So to help you make sure you know these contraindications and you don't skim over them in the book, we put red flags. Okay, we put red flags around them so you can clearly see them, because you will need to know that to prepare for the exam. So knowing that you know all your red flags and cautions, you can be sure you're going to get answers right on the exam. Okay, 11, 12, and 13 covers all the approaches that are used according to different frames of reference. In the CODA exam, cognitive perceptual is included in the neuro chapter, so it's neurological and cognitive perceptual evaluation intervention. And that's because there are many specific cognitive evaluations in the OT book that would not likely be tested on the OTA exam, so they're not in the OTA book. Now, another new addition to the book, which I was glad about also, to the exam, which I was also happy about, like burnout, because I think is important for us to know as OT practitioners, is the history of trauma and adverse childhood events. So something also I've always taught from the beginning of time and has been in the book for decades is the radar approach for domestic abuse. So you may be asked, how do you approach someone where there's expected abuse? Both review and study guides have comprehensive information about child abuse, elder abuse, patient abuse, domestic abuse, and intimate partner violence. So information is there, because I know sometimes I did a course this weekend and I asked the students, because we have a sample question about someone who appears to be an issue of child abuse and partner violence. And I asked them how much they covered that in their program. And they said, well, they know they have to be mandated reporters, and they take the thing to get for field work that they are, they have completed the knowledge about child abuse, but they said they really didn't cover anything about domestic violence and intimate partner violence and domestic abuse. And it will be on the exam, because that is trauma and that is adverse effect. Okay. Chapters 10 and covers psychiatric and cognitive disorders, and 14 covers your psychosocial approaches. Okay, one of my favorites, I do a online office hour content review about this. I'm a huge fan of knowing universal design. My practice was in mental health, but I stayed very active in accessibility and community participation and adapting environments, because my brother had Friedreich's ataxia. So I'm definitely a generalist in many ways. And they say you need to know your ergonomics and universal design. We have a very nice table in chapter 16 in the OT and chapter 15 in the OTA, because again, one of this chapter was 12 and 13 is combined. And we go through all the principles of the 7 principles of universal design and describe them and then give an example. So, and the examples I really like, I added a lot of examples to the new editions, because the exam will, will ask you, how we're going to be using a universal design, and you'll have examples of things, and you need to know what is a universal design component. Okay, so they are things that can useful and able that people can use without any accommodations, such as opening a door like this. Okay, fall prevention is also something that is now specifically added. They always said about preventing risks and hazards, but now they specifically do have fall prevention. And we have some very nice tables about extrinsic fall factors in the home, a very nice table about extrinsic factors in clinics, you know, because you may get like, okay, you're a supervisor, you know, how are you going to, you know, make sure your clinic is preventing the risk of fall. So that's a nice new table that we've added. Okay, and this is chapter 15, chapter 14 in the OTA, chapter 15 in the OTA for this, and covers all your ADLs, IADL, health management, family participation, play, leisure, education, work, okay, rest and sleep. So all areas of occupation that are in the practice framework are covered in this chapter, and it goes through evaluation and intervention, including all the different types of adaptive equipment and what people can do at different levels of spinal cord injury. Okay, so there's a lot of information in there. And then the mastery environment covers all of your home safety. And these are all things you know. All these headings things are things that are directly also pulled from the NBCOT content outline. Low vision, fall prevention, as you just saw, all the accessibility standards, functional mobility, seating, assistive technology, community mobility, computer use, driver rehab is in there. And all of these topics relate to what is asked and cited on the NBCOT exam as being things you need to know. So we have put together the information that we know is required. Okay, so another question that came up, so that's the content. So basically all those table of contents is the content you need to know. When should I start studying? How much time is needed? The fact is, it depends. There's a lot of variables that impact when for how long you prepare for the exam. Our personal and professional responsibilities. You know, I had a student had 2 toddlers and MS. Instead of doing a 6-week plan, she did a 6-month plan. She took the exam in 3 months. So you really need to be realistic about that. I'll talk about the course, but in the course manual, we have a lot of forms to really assess where you're at and how long you need to do. Typically, though, most exam candidates start preparing when they become eligible. So when you're done with fieldwork, done with capstone, and they usually take 4 to 6 weeks to prepare. That's the typical. But always remember, not all of us are typical. So be kind to yourself. Don't try to line yourself up with what other around you are doing. Do what's best for you. Now, a big thing is there should be no press to study for exams while you're on fieldwork or completing the capstone. These experiences should be your top priority. They provide you with the opportunity to be a sponge, to soak it all in, to ask questions, you know, to take risks, to fine tune your skills. This is an opportunity that once you're a licensed therapist or assistant, you're not going to get that big of an opportunity as you will ever on your fieldworks or your capstone. Okay. Now, the fact though is you could study material that relates to the focus of your fieldwork. You know, if you're doing an upper extremity musculoskeletal thing, study chapter 6 and 11. If you're doing school-based practice, study the things related to school-based practice, you know, the ABC model, okay, the different tiers of intervention under your response to intervention, you'll study that stuff. And that will strengthen your experience in fieldwork or capstone because you're really on top of everything, and to make your future exam preparation more efficient. You won't have to study that stuff very hard. You'll just be reviewing it. Also, sometimes there is downtime during fieldworks and capstones. So you may want to study the hard stuff. A lot of people find chapter 5 hard because there's a lot of developmental milestones. And sometimes PEDS was a couple of years ago. So you may want to study that and like maybe make your study cards or get, you know, the stuff that you don't remember at all. You know, head mono that semester and you're not remembering it. You know, get it down so that's not like you have to study hard. That when you're done with your field work, it's like now reviewing. It's not must study. It's need to review. And that could, you know, decrease your pressure. But don't feel pressured to do that. If you have a very busy and very active fieldwork and you're very engaged with your capstone, take your time and enjoy that. There'll be time afterwards to do the study. Okay. How do I best prepare for the exam? Study tips. Okay. An important thing to know, there are 2 aspects to certification exam success. One is mastering exam content via having a target exam preparation plan. I don't have time to go through the complete of how to do that, so I will be sharing resources. And again, the YouTube channel has a number of videos that talk more in depth about that. And you also need to know, though, how do I determine those correct answers within the allotted time? I'm sure many of you had the experience where you've had taken practice exam or exams and courses and you're down to two. And how do I figure out which two? Okay, out of the two, which one? Okay, out of six, I know two are right, but then out of the remaining two are wrong, but out of the, or one is wrong, but out of the remaining three, I don't know which one is right. So how do you determine that? What is the strategies? Okay, so those are two aspects. Now, whatever products you use, okay, there are a number of products out there. Do make sure they provide you with current, accurate, comprehensive, organized, and well integrated content that is directly related to the CODA or OTR exam content outlines. This way you want to know right away that what you're studying is applying to the exam. You want to make sure the products give you effective test taking time management strategies, help you complete the exam in a lot of time. If you read a lot of things sometimes on social media, and when people come to the courses who didn't take the course and they have failed, and then they say, well, I think I should take a course. A lot of times it's they ran out of time and they didn't know how to manage the time. You want to make sure also sure that the practice exams you take accurately reflect the different types of exam items you're going to see on your exam, and that you get some real-time experiential learning and individualized live supports. I'm a firm believer in learning by doing, so those are questions no matter what you are. Now, of course, which are most beneficial should I use? What's most beneficial, what should you use? As the editors of TherapyEd's, review and study guide since 2000, and joining TherapyEd in 1998, so it's been a long time, I am admittedly biased that our products are good, but we work very hard to make sure they are good. And we are all educators, okay? And it is not a huge for-profit company. They are not rolling in the dough. They try to keep things as reasonable as possible. So it was founded originally by two physical therapists. One who has since passed away, and his children have taken it over. But their goal was to help physical therapists pass the exam, and it was founded in the early 1990s. And then in 1997, they hired someone to put together an exam prep course, and that's when they realized they needed a book like they had for the PT, and that's when I got hired in 98 to do the book. So it was always driven by helping therapists become therapists. That people who are qualified sometimes and have done very well in their field work, very well in their schooling, sometimes struggle with an objective exam that's so comprehensive. So what are the strategies to help them pass? So that has always been the goal. So I am biased. Now, as I said, NBCOT and AOTA have ethical products. Okay. I will explain why I think ours, are worth considering, but they would meet those criteria that I said about, except for the experiential live, we're the only ones to do experiential live exam prep. So here are resources. We read and study guide, 3 online practice exams, online on-site prep courses, prep app, tutoring, online office settings that are office hour sessions and content reviews that are free, exam by week on social media, that of course is free, and these recorded things that go on YouTube, those are also free. So I'm going to go through each of these briefly. You saw a lot of pictures from the books, because that's all those pictures came from the book. So you can see they, have a lot of information, and from the table of contents. All the contributors to the book are OT practitioners, OT educators, or content experts. And they do an extensive update to make sure that they're providing all the information providing is current and accurate. We take out stuff that gets outdated, and we put stuff in that is current. They make sure they fully cover. Everybody has to go through that content outline for the CODA and OTR, and I do a double check to make sure that nothing is missing that's in that content outline. So when you use these textbooks, you will know that you're not missing any content. And then they do impart effective test taking time management strategies. Okay, and those strategies are described in chapter 1. This is, and the OTR, text has certification of occupational therapist. It gives you all the information. I don't have time today to talk about testing accommodations, but I have a recorded webinar on YouTube about students who struggle. It was done for educators to try to help students who struggle. But if you are someone who struggles and or you need testing accommodations, I suggest you watch it, because I talk about why testing accommodations are so important for exam success, even if you've never used them in your program, because there's a difference between program exams and the NBCOT exam. And this talks about it. And there's a nice table in both that describes those differences. And then this gives you all the information you need about effective exam prep, how to structure an effective exam plan, how to clinically reasoning through. So all those things that, are covered in depth in the book and in depth in the course and in depth in some webinars that are online. Okay. Now the book, I meant to have it up to show and tell. It can appear daunting because there's a lot of content in it. It's important to know that there are in the OTA 269 tables and boxes, OT 296. Okay. And that's largely due to the added criteria in the OT content outline about research and, and some extra things that OTs do that OTAs don't, but they're very, very similar in the number of tables and boxes. 290 versus 287 exam hit boxes, caution boxes that are almost the same, and red flag boxes. These are all things that are there to highlight so you know what is must study. Okay. The other thing that's a nice feature is at the ends of chapter 3 to 15, in the OTA review study guide, 3 to 16, the O, there are open-ended content review questions, and these are just some examples. And they're really great preparation resources for study groups. You can quiz yourself, each of you, when you finish your chapter. So they make great resources for that. A good thing about our review and study guides, you get access for 12 months. So you don't have to buy separate exams. You get 3 exams, okay, that are included with this. And you get very detailed score reports. And immediately after, you will get a score report that, right afterwards. And it will tell you how long you took to complete the exam, the items you answered correctly, incorrectly, and the percentages according to the domains of the exam, critical reasoning skills, and content categories. You can click immediately on the item. You get a detailed explanation and a rationale. And then there's the thing at the bottom that's an artificial intelligence called a learning assistant, where it has frequently asked questions like what's the diagnosis mean, what's treatment, and can even fill in and ask. So it's an extra supplement. Like what is peripheral neuropathy? It'll tell you the answer. And then we give you in chapter 2 guidelines on how to use this information. So this is an example of the box. If your domain scores are low, what should you do? Okay. If your critical reasoning scores are low, what should you do? Okay. There's a very nice table in both books that talks about if you have difficulty with the type of reasoning, what you should do. Again, we don't have time to go through these, but in the other webinars I've done, I've gone into more depth on some of these things, and it is in the book. So we do give you guidelines what to do, because there's nothing I think more frustrating when you don't have a great score, and then what do I do with this information? So we guide you through on what do you do with this information if you have a lower limitation in one area. Same as with the content areas, okay? And it tells you again what you should do. And then it also has a table that if you are low in this category, these are the chapters you should study. So you then know where you need to go to get the information. Okay. Now, the review and study guides are very efficient and economic. You only really need one resource. You don't have to spend a lot of money. That synthesizes all the content that can be tested, effectively determined. We do use the principle of learn by doing for the courses though, because this is how to learn how to answer questions. You got to do experiential learning. They're offered online on campus. There are school discounts, and there's discounts, by the way, for the book too, bulk discounts. And when you take the course, you get the newest edition of Review and Study Guide and a manual that basically walks you through and has a lot of self-assessment and prep forms. They're all taught by instructors who have over 30, 40 years in exam prep in education. And they basically provide all the things you need to know to pass the exam. And we do a lot of experiential learning. Okay. I'm conscious of time, so I'm going to go through this. Therapy Ed also does offer tutoring, okay? Private or in group. Some academic programs pay for it. Other times people pay on their own. The most important thing to know about the tutoring of Therapy Ed is they are very proactive. Person is very focused on you, and they will never contact you to sell more sessions. You decide how many sessions you want to need, and most find 1 to 2 sessions get them on track. Therapy does a test prep app. It's a mobile app. And you can then take, because with the online exams with the book, you want to take them as a 4-hour exam, to really get the experience. But say you want to do, you're not doing so well in one domain or content category, critical reasoning, you can pull and filter, okay? And this can increase the efficacy of your study plan. This is what I really want to highlight is we have free online office hours, 7 to 8 Eastern time. So for you guys, it'd be 6 to 7. We do top 5 must-know content about area, and they're hosted by instructors and who is an expert on the topic. And then there's always time to ask about questions, anything you want to know about the exam. And these are our list of topics that we do throughout the year. And as you can see, they cover, every one of these covers something we know is on the exam from the content outline. Therapy Ed YouTube videos, these are just some videos that are on there, and they're free. On Thursdays, we post on social media exam item of the week. Sundays, there's a rationale provided on social media, and on Tuesday nights during the content review, the instructor reviews the question. Okay, so in conclusion, Therapy Ed difference, and these go back to the questions I asked that you should ask yourself for any product. Does it provide you current and accurate information about NBC's certification exam content, format, and procedures? Is it organized and well integrated to relate to the content outline? Does it provide you those effective time management test-taking strategies so you can complete the exam in a lot of time? Are there the practice exams that give you the different types of exam? And is there real-time experiential learning opportunities and live supports? Our courses, again, are either online or in person, but they're very intensive and a lot of experiential. And then we have the office hours and tutors. And the really important one are the product providers, experienced, well-regarded educators with established reputations for excellence, integrity, and service to the profession. The team Therapy Ed, there's 16 who do OT, is very proud that the quality of our products and resources, expertise of our instructors and text contributors can ask you, enable you to say yes to those questions. And whatever you buy, make sure you can answer yes to the reputable and that it is done by reputable OTs. Okay, I know I went through a lot and I apologize that I should have probably had a few less slides. It's always hard to time how many slides to have. But are there any questions that I can answer for anyone? And I'm okay if we go a little later, but I know people may not be able to stay later.
There is one question in the chat asking, how do we access the online office hours on Tuesdays? Is there a link online?
Yes. If you go to therapyed.com, just go, therapyed.com, put it in Google, therapyed.com. There'll become a screen will come up and it'll have speech language pathology, physical therapy, occupational therapy. Click on occupation, it'll say occupation OTR or CODA. Click on either OTR or CODA. It winds up going to the same place, the office hours. And then there'll be a toolbar. It'll say review and study guide, course, app, online office hours. Click on the online office hours, scroll down, there's a box that says join now, and you join. No registration needed. Just click on. I could always tell people at 7 o'clock, a lot of times there's maybe 20 people. By 7:05 there's up to like 90, 95, and during COVID we had up to 500 people. We had to move the room from 100 people up to 500. We would have 500 people signing in, and they would sign in early because it got a reputation for being very good. We could always tell, like after 5 minutes, like no one's signing up, and then all of a sudden there'll be a rush of like 20 people because someone must have texted them that this is good, and then you get another 20 people. But they're good. They really are. They're basically, the instructors walk you through the content that's about that topic and how it applies to the exam, and they're free. So those of you who want field work or capstone, that's an easy way to do some exam prep. That's not heavy duty and would not interfere with you focusing on what you need to do for field work or capstone. So I do recommend those.
Right.
Okay.
Someone else is asking, do you have to get all 3 answer choices right to get credit for the multi-select questions? Is there partial credit?
Yes, I actually took that out because I knew I'd be maybe getting close to time. So I do have an exam. No, thankfully not. The prior exam, when the 3 out of 6 options were first introduced for the CODA exam, you had to get all 3 right to get credit. About a year or so ago, they stopped that. I don't remember the exact date, so time flies by. But they did stop doing that now you get partial credit. So if you get 1 out of 3 right, you got that credit. 2 out of 3 right, you got that credit. 3 out of 3, you get all. Yeah, so that used to be. And if you see any product that is saying that, I know our product did when 2019, when we first published, it was, you had to get all 3 right. And then they changed it. So, and we do have a little caveat in our book that our stuff is current up until, you know, as a publication date, but we immediately updated our course to reflect that you don't have to get all 3 right. That's a good thing about the course, update things right away without having a publication thing. But no, you do get partial credit now. Very good question. Thank you.
We have one more. How many questions do you have to get correct on the OT exam to pass?
Well, that is the unknown, to be perfectly honest. MBCOT scoring, it's kind of like goes from 300. So you get 300 just from clicking in. You don't have to answer any question. Your score will be 300. 300 to 600, and passing is 450. So midpoint. But I would not say only get 50% right, because the exam is weighted, and it's a very complicated statistical program, but it's what all professional exams and these types of exams do. The GRE, the score is not 80%, 90%, 70%. The SAT, they all do those numbers. And I once asked, there's a fantastic professor who had the privilege of working when I was teaching at the University of Scranton. And I once asked him if he could explain it to me, because he was the type of professor who could explain everything in a very simple way. And he said he couldn't explain it. He just said, just tell the students it's fair. So now the big question that's a follow-up, well, how do I know when I take the practice exams if I'm ready for the exam? And in the course, we talk about this quite a bit. And it's actually in the back of the book, there's guidelines for effective use of the online exams. And it tells you like how to make sure you set it up and all that. But then we have a section about how do I know I'm ready? You know you're ready when your answers are that you get wrong are on the harder questions, not on the basics. You know you're ready when your answers, the things you get wrong, are a scatter plot. It's the hard ones and it's all over the place. It's probably not a good idea to go on the exam if you're getting less than 60% right in a major content area, because even though maybe you're doing good in the other content areas, again, and it may average out that you'll pass, okay, but the anxiety that causes, that every time you see something from chapter 16 or 15 in the OT book and you didn't study because you ran out of time, anytime you see something about functional mobility, accessibility, universal design, you'll wind up getting anxious. And one of the biggest problems with failing an exam is spiraling into anxiety. You start second guessing yourself and making mistakes. So I would say if you get on our practice exams, AOTA practice exams, MBCOT exams in the low 70s, and it's a scatter plot and all the hard questions, you're okay. Now we have to change, to be perfectly honest, on our practice exam portal. I don't, the person who does that is not an occupational therapy educator, it's a tech person. So he just updated the portal and he put in that the score report that, someone got a 72, one of the instructors took it, which is a okay score, particularly she is a scatter plot. And it said, it's good, but not the 85% that we recommend. We're like, who recommended that? We don't recommend that you have to have 85% on a practice exams. You really don't, unless again, you have a serious deficit, like you get 90s and everything, you have 50 in another, then you should still, even though you get 85%, that's great. You want to master, get that 50% up to 65%, because again, that will increase anxiety. So we have to get this person to change that. We say 75, 72, and again, if it's a scatter plot. And that's, again, in the very back of the book, like the last page of the book, will have that information on how you know you're ready.
Wonderful. So it looks like we're about to conclude. Any last minute thoughts?
Yeah, I do see this one, Nardine. I would not, if you do not, or if you have the 9th edition, email me. I will, Jennifer can send my email to everyone, or let me put it in the chat box. Let me see if I can do this for everyone. If you have the 10th, no, I don't see where I can do that. Okay. If you have I'm not seeing that. My email is rpcot ot@yahoo.com. Rita Patricia Castaldi, occupational therapist at Yahoo. If you have the 9th edition, I have a handout that tells you, gives you the burnout information, the CDC information I showed, and tells you what's recommended. If you, because the 10th edition definitely has a lot of nice now boxes and tables and figures that aren't in the 9th edition. And to be perfectly frank, that's because they take time to do. And I just retired from full-time teaching, so I had more time, so I could do it. But the content, everything that is in the 9th edition is relevant. But for those of you who don't have the 9th edition, buy the 10th edition, and for the CODA, buy the 5th edition. Because you buy an old used edition online or from Amazon, you will not have access to the practice exams. And that's a big feature of what makes the book economical, because you get 3 full exams. Okay, so I would not buy a used book. I would buy the new book. But if you have it, it's perfectly acceptable. It's good. Thank you very much, Jennifer, for my email in there.
Yes, thank you for sharing that. Well, we don't want to take up any more of anybody else's valuable time, but we do want to say a big thank you to Dr. Fleming Castaldi for sharing all of this information and for specifically individualizing it to our students and to their questions and to where they are in their programs. It was so valuable. And I encourage you all, if you have any other questions, you can reach out to her via email or check out the YouTube channels or the websites or any other resources that she has shared with us tonight.
All right, and I thank you, Jennifer, and Tennessee OT Association, all of you who took your time to attend this evening, and I thank you for your time and attention. And hopefully one day, maybe I'll see people at the AOTA conference. Come back by the therapy booth and say howdy.
Thank you. Thanks again. Everyone have a good, safe evening.
Thank you.
Thank you. Bye-bye.